Welcome back, viewers. Let's take a look at the latest developments of this hour. Prime Minister Narendra Modi will chair a Union Cabinet meeting at his residence at 7 Lok Kalyan Marg today. Reports have suggested that the meeting comes at a crucial time as the government continues to assess internal security and policy matters in the wake of the recent developments. Important policy and the security issues are also likely to be discussed. Along with this, there is also focus on the allocation of enhanced budget for the DRDO. Sanjay Sharma is joining me live on the broadcast with more updates. Sanjay, what are you picking up this morning? The big thing that we are tracking is the meeting that will be chaired by Prime Minister Narendra Modi at 11 a.m. at the 7 Lok Kalyan Marg. The CCS meeting is going to take place later. Share more details, Sanjay. All right. Now, in fact, Prime Minister Narendra Modi is going to chair the cabinet meeting at 11 a.m. This is going to be the big meeting that is happening after Prime Minister Narendra Modi has concluded his Gujarat visit in Gandhinagar. Crucial decisions on how India's retaliation to the attacks by Pakistan will be taking place, as in fact cabinet meeting as his residence is being held at 11 a.m. Earlier, the cabinet meeting took place on the 30th of April. All right, Sanjay Sharma is there with me live on the broadcast. Sanjay, what more details are you picking up? Share the latest in this regard. All right, now let's take a look at more developments. Chairman of the Democratic Progressive Azad Party, Ghulam Nabi Azad, has been hospitalized in Kuwait. Amidst the all-party delegation visit, the leader is part of the BJP MP Baijant Panda's delegation, where his health suddenly deteriorated. He is currently stable and under the supervision of the doctors. Now, MP Baijant Panda has confirmed the same and stated that his presence will be missed in the next course of the delegation. Jai Panda has also stated that he is stable and under medical supervision and he will be undergoing some tests and procedures. His contributions to the meeting in Bahrain and Kuwait were highly impactful. And he is disappointed at being bedridden, and also in fact stated that we are deeply going to miss his presence in Saudi Arabia and Algeria. Brian Thomas is joining me with more updates. All right, as in fact my colleague isn't present at this point of time, let's also shift our focus to more developments. Ghulam Nabi Azad's health deterioration has taken place in Kuwait, and as we can see in the pictures, the delegation has visited him in the hospital rather, where he is admitted, and also taking in fact the health update as Ghulam Nabi Azad's health status then was deteriorated while being on the visit abroad. Asavri Jindal, my colleague, is joining me live with more updates. Asavri, what are you picking up as Ghulam Nabi Azad's health reportedly is being now considered as stable, and what exactly is the statement from the delegation MPs led by Baijant Panda is saying.
Absolutely. Simran, let's quickly just give our viewers an understanding on what exactly has happened over here. Of course, he is a part of the Indian delegation, and what we are understanding at this point of time is that the former union minister and a part of the all-party MP delegation was hospitalized in Riyadh, Saudi Arabia during their tour. Bajayant Panda, their delegation leader, confirmed that he's in a stable condition, and there is an ongoing medical supervision that is underway at this point of time. So clearly he's not in danger at this point of time. Of course, visuals are coming in at this point of time of the delegation over there meeting him, and of course he is bedridden at this point of time, but he looks more or less better at this point of time from the visuals that we are looking at. Now the delegation will be proceeding to Algeria, and Ghulam Nabi Azad, however, will not be present during the next steps of the Indian delegation tour. So again, he is going to be now just sitting, resting at this point of time. He is not in a dangerous condition right now. He's more or less stable, but he will not be continuing his visit with the rest of the delegation. He's just going to be taking a pause for a cause. Simran, back to you.
All right, Sabri, thank you very much for the latest updates. Now, let's take a look at the other developments. The COVID-19 cases surge continues across the nation, with in fact the total number of the active cases now reaching the mark of 1,107 from 1,009 on May 27th, with the 787 new cases reported within a week, while doctors continue to assure that the cases are mild and there is no cause of worry. States have issued guidelines asking people to take necessary precautions against the spread. All right, viewers, the COVID-19 cases surge continues. All right, Arzu Seth is joining me live on the broadcast with more updates. Arzu, what are you picking up in the latest as far as the active cases of COVID-19 in the country has spiked, also breaching the mark of 1,100 as well?
Well, COVID-19 has spread once again as cases rises in the country, with the total coronavirus cases in India reaching to 1,110, and however, with the mild symptom, expert has advised people not to panic, but state advisories urge residents to maintain hygiene. In fact, if we talk about the new variants NB181 and LF7 are under observation by the World Health Organization, and no reason for concern has been flagged yet. And as cases rises in Kerala and cross the mark of 400, residents are concerned, and spikes were also observed in Delhi, Maharashtra, Gujarat and other states. Punjab, in fact, reported its first case earlier today and have begun contact tracking. And according to the latest data from the Ministry of Health and Welfare, Kerala has reported the highest spike among all states with the rise of 335 cases. Maharashtra follows with 153 new cases, and Delhi has recorded 99 additional infections. As Delhi NCR's total cases rises to more than 100, Gujarat has seen an increase of 76 cases, bringing it overall tally to more than 80. And in fact, Delhi CM Rekha Gupta asserted that the hospitals are fully prepared to tackle in the if the number of cases surges. So yes, there has been a alert in the both government and private hospitals, and it is being said to prepare fully, whether we talk about the oxygen cylinder, beds, emergency situation. All the preparation should be done in the hospitals, and health officials remind the citizen that the situation is under control and there is no need to panic. The transmissibility and the effectiveness of the existing vaccine on these variants are on close monitoring. So on all aspects, whether it's about variant, vaccine, all the preparation and also the monitoring is now being done, and in fact the sample has been collected to ensure that is there any new variant or to study any new variants.
All right, Arzu, stay on with us on the broadcast, as in fact what we are picking up in the latest is also that the COVID-19 cases have continued to surge in the states of Karnataka. with a total of 80 active cases reported in the state. Now, Karnataka has reported its first COVID-related death as well. Meanwhile, Chief Minister Siddaramaiah has held a review meeting as the cases surge in the state. Out of the 80 cases in the state, 73 are from Bangalore alone, with health administrations being asked to remain vigilant. Belly Thomas is joining me live on the broadcast, in fact, to share more details. Belly, what is the status of the COVID transmission in Karnataka? Bangalore is in fact, Bangalore has been reporting more than 70 cases. Is it going to be the next hotspot?
Simran, as on today, as on Wednesday, the number of COVID infections have come up to around 100, and on Monday, the number of active cases was around 70, and on Tuesday, 36 others were other cases were tested positive, and in that, around 16 people were discharged. Is what we gather from the health department here. So, as on today, the number of active cases stands at around 100. And the state government, the health department has issued advisory to the members of the general public to follow all COVID appropriate behavior. And though the wearing masks is not mandatory, people with respiratory illness or the SARI symptoms are advised to wear a mask, and the hospitals have been directed to stock all the COVID-19 infrastructure from ventilators to hospital beds and oxygen supplies as well. And the state health minister Dinesh Gundarao and the medical education minister Sharan Prakash Patil have also working on reviewing the preparedness of the hospitals across the state, wherein even remdesivir doses have been stocked, and the number as such is kept under watch. And there is also the hospitals have been asked to increase the number of testings, and people who have symptoms of respiratory illnesses and SARI symptoms are advised to take up the RT-PCR test. And each of the hospitals have been asked to stock at least 5,000 RT-PCR kits. And Karnataka recorded the first death of an 85-year-old person who had been admitted at a private hospital in Whitefield, and he was tested positive 2 days before his death.
This is one of the latest surge that are continuing to even transmit to many states. Of these deaths, the highest number of deaths that have been reported are from Maharashtra, where 5 people have died. Other deaths have been reported from Kerala, Rajasthan, Karnataka, Madhya Pradesh and West Bengal. Now, from Maharashtra, where the highest number of deaths have been reported, joining me live on the broadcast is Shahid Ansari, my colleague. Shahid, what is in fact the state of transmission in Maharashtra, where the highest number of deaths is being witnessed to have reported? How exactly the measures in place are curbing the transmission as more people are succumbing to this virus in Maharashtra alone?
जी सिमरन, सबसे पहले जो है मैं आपको बता दूं कि जो स्वास्थ्य विभाग की तरफ से जारी किए गए आंकड़े हैं उनमें सच में जो है महाराष्ट्र में 5 लोगों की मौत जो है रिकॉर्ड की गई है, और ये मौतें कोविड से हुई है। इनमें एक कम सबसे कुछ 21 साल की उम्र की एक युवती है जो कल्याण इलाके की रहने वाली थी, वो उनकी भी जो है कोविड की वजह से मौत हो गई है। जबकि अगर एक्टिव केसेस की बात करें तो ये एक्टिव केसेस 208 है। मौसम विभाग की तरफ से जारी किए गए आंकड़ों के बारे में सबसे पहले मैं आपको बता दूं, फिर उसके बाद राज्य जो है इसको लेकर जो है क्या एहतियातें बरत रहा है उसके बारे में बात करेंगे। जो अपडेट आई है जो स्वास्थ्य विभाग की तरफ से, उसमें देखिए बहुत अहम है, ये जानना जरूरी है कि देखिए इस महाराष्ट्र में जहां आज सबसे ज्यादा केसेज हैं उनमें जनवरी में सिर्फ 1 केस थे, फरवरी में 1 केस, मार्च में कोई केस नहीं थे, अप्रैल में 4 केस थे, जबकि मई आते आते इसकी तादाद 310 हो गई। यानी आप अंदाजा लगाइए कि जिस राज्य में महज 1 केस थे उस राज्य में 310 केसेस कोरोना के जो है पॉजिटिव पाए गए हैं। हालांकि इलाज भी हो रहा है। इसके साथ साथ राज्य सरकार ने जो है ये भी कहा है घबराने की जरूरत नहीं है। मतलब ये है कि भाई जो भी केसेस सामने आ रहे हैं उनका इलाज आसानी से किया जा रहा है, और इसके साथ साथ राज्य सरकार जो है या स्वास्थ्य विभाग पूरी तरह से तैयार है। अब तैयारी कैसी है इसके बारे में जानना बेहद जरूरी है कि देखिए मुंबई में 2020 और 21 की बात अगर करें सिमरन, तो वो हालात बहुत नाजुक थे। उस वक्त हॉस्पिटल थे, सब कुछ था, लेकिन हमारे पास उपचार के कोई तरीके ही नहीं थे। हॉस्पिटल में भीड़ थी, लोगों को जो हॉस्पिटल में जगह नहीं मिल रही थी। लेकिन अब ऐसा नहीं है, अब स्वास्थ्य विभाग पूरी तरह से तैयार है। मुंबई की बात करें तो सबसे घनी आबादी वाला शहर है और कोविड में जो है कोरोना से बचने के लिए सबसे ज्यादा जरूरी है एहतियाती तदबीरों में डिस्टेंस मेंटेन रखना। तो मुंबई में वो हो नहीं सका, यही वजह रही कि 2020-21 में बहुत ज्यादा जो है मौतें हुई और तादाद भी ज्यादा रही।
All right, Shahid, thank you very much for these detailed inputs from Maharashtra, where most number of deaths have been recorded due to the COVID-19 surge. Now in Uttar Pradesh, a 78-year-old corona-positive elderly man has died during the treatment in Firozabad, making it the first COVID-related death reported from the state in this recent wave. While if at all this is a wave or not is something that experts and also the health department is going to now inform us about. While about the updates from the Uttar Pradesh, Abhishek Singh is joining me live on the broadcast. Abhishek, what are you picking up as far as Uttar Pradesh's status with relation to the COVID-19 transmission is concerned? 78-year-old man dies in Firozabad due to COVID-19 transmission. Share more details.
Yes, as per we talk about the COVID and its precautions, now the next what we are learning from the sources that the cases are getting bit increased day by day in Uttar Pradesh also. Although in earlier days the cases were spontaneously found in the NCR region of the UP, either it's the Gautam Buddha Nagar or the Ghaziabad area. Now the cases are being spreading fastly, and many of the cases are being seen. Also, what we are learning that the Deputy CM of the UP and also the Health Minister of Uttar Pradesh, Brijesh Pathak, has given the orders to the health officials that they should follow the strict SOPs of the COVID. So the sanitization and also the distance maintaining and also the isolation wards are being made for the precautionary of different hospital and super specialty hospital. One case was found in Firozabad. The 78 years elderly person died because of the COVID. He was infected with COVID and was under treatment. Was also infected with some of the other diseases, and after his death, the different cases of COVID were intensely taken care of in Uttar Pradesh, and also the number is still growing from 15, and also the precautionary measures and the SOPs are being followed in Uttar Pradesh. Also, the Chief Minister of UP, Yogi Adityanath, has given strict orders to the officers to be on ground. Also, the health and the other departments should be taken care regarding the COVID SOPs.
All right, Abhishek, thank you very much for adding more details. Now, the director of the Indian Council of the Medical Research, Dr. Rajiv Behel, has stated that so far 4 COVID-19 variants have been found in the country. These include LF.7XFG, JN.1 and NB.1.81 variants. The ICMR has maintained that these cases reported so far have been mild, and there is nothing to suggest that these variants might be more severe or communicable in any way. Let's listen into the latest details given by Dr. Behel.
इन टर्म्स ऑफ कि जो कोविड के केसेस हैं वो तो सबको ज्ञात है कि थोड़ा केसेस में इंक्रीज़ हुआ है और केसेस कुछ बढ़े हैं, और आपको नंबर्स मालूम है कितने हैं। पहले साउथ इंडिया से, वेस्ट इंडिया से और अब नदर्न इंडिया से भी कुछ केसेस रिपोर्ट हो रहे हैं। जब भी कोई केस बढ़ता है तो हम 3 चीज़ों पे ध्यान रखते हैं। उसकी पहले मैं बता दूं कि मॉनिटरिंग कैसे होती है। सबसे पहले तो हमारा एक सिस्टम है IDSP, इंटीग्रेटेड डिजीज़ सर्वेलेंस प्रोग्राम। वहाँ पर जितने भी केस कहीं से भी पूरे देश से रिपोर्ट हो रहे हैं उनके ऊपर नज़र रखी जाती है। इसके साथ साथ सेंटिनल सर्वेलेंस, एक पैन इंडिया सेंटिनल सर्वेलेंस ICMR का प्रोग्राम है, जिसमें 73 मेडिकल कॉलेजेस में जो वायरस डायग्नोस्टिक और रिसर्च लैब्स हैं वहाँ से कॉन्स्टेंटली, ये नहीं कि जब केस रिपोर्ट होंगे, कॉन्स्टेंटली हम लोग ये देखते रहते हैं कि क्या केस आ रहे हैं और उसका कितने उनमें से कौन सी बीमारी की वजह से है, कौन सी इन्फेक्शन, कौन से पैथोजन की वजह से। इन टर्म्स
Aditya Vadavan, my colleague, is joining me with more updates. Aditya, what is the ICMR's latest stand in terms of apprising the nation about the health status of the patients who are being infected with COVID-19? Is there, as ICMR has just said, that these are the 4 identifiable variants. What more are you picking up?
Well, absolutely, Simran. If you see, the statement from the ICMR comes that the people who have contracted this variant of the COVID-19 virus are said to be stable, and as per their statement, these variants of the COVID-19 are said to be mild variants. Because as of now, there is nothing to worry about. But the fact remains the fact that the COVID-19 cases there's been an uptick in the COVID-19 cases. Be it in Maharashtra, be it in Delhi. So gradually now this could be thought as the beginning of the resurgence of the COVID-19 pandemic. However, as of now, there is nothing to be alarmed about. But at this juncture, the certain measures that were adopted during the COVID-19 pandemic, when the outbreak had happened in the year 2021, certain social distancing and some basic hygiene has to be maintained, so that to prevent any further contraction of this virus. Otherwise, we have seen that how these variants of the COVID-19 can turn virulent in the times to come. However, as of now, it is just to maintain and observe as to how the situation unfolds, and the ICMR is now closely monitoring the COVID-19 situation. Yes, Imran.
All right, Aditya, thank you very much with these latest updates. Now let's take a look at more developments. New high-resolution satellite images have shown extensive damage to the Murid Air Base of the Pakistan, showing a 3-meter wide crater just 30 minutes from an underground facility of the Pakistan Air Base to the rooftop of a structure adjacent to the unmanned aerial vehicle hangars. With the image 1 on your screen has shown the undamaged building at the Murid, a forward operating base in Pakistan. The image 2 shows in fact the damage caused of the air base, as you can see it on your screens. Meanwhile, the image 3 and the following image show the munition crater near a likely underground facility at Murid. All right, these are the 3 images that we are tracking at this point of time. From first to third image, my colleague is joining me with more updates. As we can see, there is significant amount of damage to the airbase and Air Force stations in Pakistan, and this is actually visible in the images where the extent of damage is being ascertained through the satellite imagery. Ajay, share more details.
Yes, 11 air bases of Pakistan was, was among the targeted by the, authorities, by the forces over here during the Operation Sindoor. And if you talk about this specific, that clearly shows that these images clearly once again exposes Pakistan, who was continuously saying that nothing has happened as far as damage to the, Air Force, Pakistani Air Force is concerned. But these images clearly shows that it was a massive damage to the Pakistani Air Force infrastructure. And earlier yesterday we have shown the images of the Noor Khan, and this time this is another airbase which was hit out, and not only the infrastructure on the ground but also the underground cavities were also hit because of the Indian operation. So that shows the capability of the forces over here, and that shows that how how tough time Pakistani forces have faced, and that's why they cried for the ceasefire between the two countries.
All right, Ajay. On that note, in fact, thank you very much. I'll request you to kindly stay on while we are also learning that Jammu